Hey friendlies, this is Dr. G and welcome to ICU Confidential. Today's topic is about x-rays in medicine. An x-ray is a quick and painless imaging test used for different purposes in medicine. The x-ray machine emits a brief wave of radiation through a targeted part of the body. The collector plate on the other side of the body absorbs those x-rays. Different tissues absorb different amounts of radiation based on their density, while the other radiation waves are deflected. The detector on the other side of the body part captures the radiation waves that pass through, creating a black and white image with shades of gray. The denser body part, like bone for example, will appear whiter on the x-ray. The less dense something is, like air in the lungs, will appear black. Fat, muscle, and fluid will absorb the x-rays in a medium amount and will present as various shades of gray. Common uses of x-rays in the intensive care unit, for example, include chest x-rays, where we can look at the ribs, the general state of the lungs, the heart, and the upper abdomen. If you're on a ventilator or you just got a special kind of catheter intravenously, x-rays are used to confirm that the tubes and catheters are all in the correct position. They can also be used to identify fluid in the lungs, inflammation like pneumonias, and even foreign objects. Abdominal x-rays are also done often in the ICU. The special patterns of air and fluid in the gut and the stomach can give us important information on an x-ray. Other uses for x-rays include looking for fractures or dislocations in bones and joints, looking for foreign objects like embedded pieces of metal or glass, and as screening tools for cancer, such as when looking for breast cancer with mammograms. X-rays generally have low radiation risk, and the amount of radiation exposure from 1 or 2 x-rays is considered very minimal. It's important to recognize that x-rays are all around us. Cosmic radiation, for example, depends on where you are in the world and how high you are in the atmosphere. On a long-haul international flight, you may be exposed to the equivalent of 1 to 3 x-rays worth of radiation. Our bodies are designed to deal with this damage to a certain extent. Clearly, you do want to limit the amount of exposure you have to these x-rays as to radiation in general. It is important to note that an x-ray will only give you so much information. It can show you big problems and major abnormalities, but typically does not give you that level of detail that may otherwise be required. Other tests like CAT scans, which are a collection of x-rays taken at different angles, MRIs, ultrasounds, and other imaging tests can reveal significantly more information. In summary, x-rays are a common medical imaging test that brings a lot of value, especially to patients in the hospital or the intensive care unit. While alone they carry minimal risk, we do have to be aware of potential complications from taking too many x-rays in too short a time. Check out the other videos regarding CAT scans, ultrasounds, MRIs, and other testing modalities. As always, if you enjoy these explanations and you just wish that you could read about all of them in one place, check out ICU Confidential, a guide for patients, families, and their caregivers. This is Dr. G, and welcome to ICU Confidential.